Chaotic control has set out on a mission to weaponize critical thought and kick your intellect in the balls. The intellectual laziness that pollutes social media landscapes needs an advocate for reason, balance, and nuanced discourse. I am your advocate. I am chaotic control. In a world full of Facebook virologists and Google epidemiologists, I decided I was done arguing with my intellectual and experientially inferior peers and decided to talk to a real expert in infectious diseases and immunology. Let's shut our mouths for a minute and listen and learn from someone who does know better. Dr. Offit, I want to thank you for taking the time to sit down with me and answer some of these questions for my audience. So let's get into it. Can you tell my audience why we should care what you have to say? It's not like you've helped create life-saving vaccines or anything like that.
Just one. So I'm a professor of pediatrics at Children's Hospital of Philadelphia and University of Pennsylvania School of Medicine. My expertise is in vaccines. I was fortunate enough to participate with a team at Children's Hospital of Philadelphia that created the vaccine that prevents rotavirus, which is a cause of fever, vomiting, and diarrhea in kids, and was responsible for about 2,000 deaths a day in the world. That was my professional life. More recently, I've gotten interested in sort of writing books and trying to educate about vaccines and science, which has apparently pissed some people off, but such is life.
I often like to say, if you're not pissing people off, you're not trying hard enough. I learned about your existence following a post you made that went somewhat viral, pardon the pun, where you questioned the wisdom of what you called draconian lockdown measures. Do you still stand by those words today, or has your position changed at all?
So I think we'll look back on this time and see what it was we needed to do and didn't need to do. I mean, certainly social distancing is critical. You look at Sweden, for example. So Sweden basically is the control group. They're saying we're going to go to work, we're going to go to school, we're going to go to restaurants, we're going to have groups of people more than 50 at once in one place. We're going to do whatever we want to do. So the question is, how have they done as compared to countries around them, like Norway, Finland, etc. And they've done worse. No doubt about it. I mean, they have about, it's around, at least as of this morning, about 750 deaths in a population of 10 million. So we have a population of 330 million, so 33 times that. That would work out to about 26,000 deaths here. So here, at least as of right now, we have 18,000 deaths. So it's the difference between 18,000 deaths and 26,000 deaths. So yes, I think that if you just do what they do, which is nothing basically, other than say if you're older, stay home, and if you're sick, stay home. So I think we will figure out in retrospect what we needed to do and what we didn't need to do, because what is absolutely clear is the second wave is coming. The second wave of public health nightmare is coming. There already are at least 15 plus, so there are already about 20 million Americans who filed for unemployment insurance. That's just the people who can file. I mean, a lot of people can't file. I think you can assume that as this moves on, at least 35 million Americans will lose their jobs. With that comes massive homelessness, and with homelessness comes domestic abuse and food insecurity and child abuse and suicide and depression. There'll be a second wave of public health nightmare to this that will also cause deaths. And so I'm just wondering, could we have done this in a more surgical manner? That's really what all I argued for, which apparently brought a flood of anger in my direction. I mean, I wasn't saying we shouldn't do anything, and I wasn't ignoring the importance of this. I was just saying that is there a more surgical way to do it, where we could have tried to create some balance? I mean, obviously, there's no perfect solution. We can, if we want to avoid all COVID cases and COVID deaths, then we should shelter in place or lock down for the next 2 years. That's the best way to do that. But we obviously can't do that. And frankly, look what happened with flu this year. With influenza, once we sheltered in place and locked down, there was a dramatic reduction in flu. Well, okay. I mean, every year flu kills 30 to 40,000 people. If we want to avoid that, let's just not go outside our homes again next year, and we'll have a dramatic reduction in flu deaths and homicide deaths and presumably traffic deaths. But the point is life is risk, and the question is how to balance all those risks. And I don't know the answer to that. I was just raising the question that maybe there's a better way to do this, which caused a lot of hate mail, including from my friends. So because they thought I wasn't taking this seriously, but I am taking this seriously. I'm just wondering how to best do it.
You can probably imagine some of the reactions I've been getting. How long can we expect it to take to develop and safely administer a SARS-CoV-2 vaccine to the world's populations?
I think if everything went well, which is to say that we were very quickly able to figure out what dose to give, which we don't know, that we could fairly quickly do an efficacy study, because you have to do an efficacy study. I mean, you don't have a so-called immunological correlative protection. So, for example, there are now 45 people that are getting an mRNA vaccine in Washington State. That mRNA, messenger RNA, will be translated to a protein, the protein that sits on top of the coronavirus. You then will make an antibody response to that protein, which hopefully will then neutralize the virus when you're infected with the natural virus. So the virus can't attach to cells. But you don't know, you can't immunize people and say, okay, I have this level of antibodies in the bloodstream, therefore I know that this person will be protected. You don't know that yet. The only way to know that is to do a so-called efficacy trial, which means immunizing some people and not immunizing others, and then letting them all get presumably exposed to the natural virus, the so-called wild-type virus, and then see what happens. I imagine that efficacy trial would be done in healthcare workers because they're on the front line, so they're the ones most likely to get infected. And it would have to involve thousands of people. Assuming all that's true, I can't imagine this gets done within 2 years. That would be the fastest it could be done, and that's ridiculously fast. I mean, the fastest vaccine ever made, not counting flu vaccines, because we make a new flu vaccine every year, but the platform is clear for how to do that. The fastest vaccine ever made was in the 1960s. There was a mumps vaccine that was made, meaning starting from just having the virus in hand to actually a commercial product was 4 years. And that was in the 60s when the FDA regulations were far less than they are now.
What do you feel the risk versus rewards are in a protracted shutdown of peoples and economies? How long can this possibly go on for?
I think we're already seeing the risks. I mean, the incidence of domestic violence has already increased. The joblessness, the hit to this country in terms of massive joblessness and all the public health problems that come with massive joblessness, we are just scratching the surface of what we're going to see with this. Because it's not just that people have lost jobs; it's people it's businesses have gone under. I mean, certain businesses can't last this long, and so when we crawl back out of our houses again into our work, I mean, there's a lot of people who aren't going to be able to crawl back into a workspace at all, and the government's notion of this sort of $2 trillion bailout, you can't bail out people's lives forever. That's just not possible. So we'll see how this plays out. But I guess I get a little nervous. I think Tony Fauci, Dr. Fauci, is great. He's a brilliant man. But I don't think the goal can be stopping all possible coronavirus cases and all possible coronavirus deaths. The goal is to so-called flatten the curve so that the healthcare industry is not overwhelmed. That's the goal, so that that you can take care not only of these patients, but of all the other people who need intensive care and acute care in the hospital. That's what you want to know. So once you get to that point, once you know that the curve is flattening, that you're getting to a doubling time of 10 days, and I'll explain what that means in a second, I think you're good. So for example, on March 26th, we had 1,000 deaths. On March 28th, we had 2,000 deaths. That's a doubling time of 2 days. That is really fast. To go from 2,000 to 4,000 took 4 days. To go from 4,000 to 8,000, 8,500 took 4 days. Now we've gone to 17,000 in 5 days. So we're now starting to lengthen the curve. So the question becomes now, and I think we were at around 18,000 actually today. When do we get to 36,000? 6 days, 7 days. I mean, that's what you want to see. Angela Merkel, who I consider to be the leader of the free world, said it best. Get to 10 days, and then I think that we can be confident that discharges will be greater than admissions. Then you can go back to work. You're still going to have more cases. You're still going to have a bump. You're still going to have deaths. But the goal is not that. You can't have that as a goal.
In your assessment as a healthcare professional, is it true that hospitals are overwhelmed in most places right now?
Well, I mean, I work at a children's hospital, and this is really not a disease that causes children to really to be in intensive care units and die. It's the rare child really who dies. It's certainly possible, but I think fewer than 5 children in the United States have died from this virus, whereas more than 150 this year have died of influenza. Certainly, so from a children's standpoint, no. In my sense, I mean, I work next to the hospital of the University of Pennsylvania, which takes care of the adult patients. They haven't been overwhelmed. And according to Rachel Levine, who's the Secretary of Health for the department here in Pennsylvania, she doesn't think any hospital in Pennsylvania yet has been overwhelmed. That may be coming up, but it hasn't happened yet. But certainly New York was hit. Washington State was hit. They were completely overwhelmed. So there are certainly areas or regions which are overwhelmed, which really has to do with the density of the population and then the availability of intensive care unit beds. That's really where the mismatch occurs. Mm-hmm. That's what happened in Italy. I mean, it was really more of a northern Italy problem, which is more of a rural area, and there just weren't the intensive care unit beds to take care of that outbreak.
Yes, the thought has also occurred to me that it would seem we've taken a one-brush paints-all approach, whereas in more dense populated areas, it makes sense to have stricter measures, but perhaps in other areas where hospitals are working under capacity, perhaps we could lessen up the restrictions. Would you agree with that?
Yeah, I think, again, we'll know in retrospect how best we could have done this. Could construction workers go back to work who are, generally have some level of social distancing or go back to work with masks on, or whatever, just people are losing their jobs, man. And it's not going to be pretty. We have to consider that.
Is the outdoors the enemy? It would seem there's ample evidence to suggest that perhaps being outside in fresh air, in higher UV environments, in higher temperatures, is actually quite detrimental to the virus itself. So why then are we making the outdoors the enemy?
I think it's simply a matter of people afraid, or the healthcare professionals are afraid that if you go out there, you'll congregate in a restaurant or congregate on a basketball court, or whatever. I think that's what it is. I mean, I'm now in Avalon, New Jersey. Actually, we have a place here, and they closed the beaches here in Avalon because I think they just don't want people to come down. But to walk on the beach, I mean, there couldn't be more social distance on the beach. People are pretty far apart walking on the beach. So I don't think that's a real risk area.
Do masks work? People making masks out of old T-shirts or panties? Is there any sense to this? Can you add some clarity to the myths and truths about masks?
Yeah, well, certainly an N95 respirator works. I mean, that's a very tightly fitting mask that goes over your nose and mouth, and so yes, that works. Most people don't have that. What most people are talking about are those sort of rectangular surgical masks. That you certainly can breathe in and out of the side. They certainly get wet, and therefore can be more transmissible. So I think that the advantage of that, and I suspect the reason the CDC is now saying that you should do that for anybody who goes out, just make a bandana. I put a bandana on my face to go out food shopping the other day. Is more to remind people to stay clear. I think that's more than the fact that it's really preventing spread. It's reminding that you really should maintain a certain distance. I think that's what it does. You see people talking on their cell phones while wearing this. I mean, touching their face, talking on their cell phones.
My follow-up question to that would be, why then isn't everyone wearing goggles? Since we know that the eyes are mucous membranes and you can contract the virus through your eyeballs.
Yeah, no, if you want total protection, you should be like in the plastic bubble, right? I mean, then you're good. Sure, no, there's no perfect protection, right?
As an expert in immunology, what viruses and diseases pose a greater threat than COVID-19 right now that should be receiving the attention and the action that this virus is? Or do you believe that COVID-19 lives up to the hype? Or in other words, Is this the hill that we should die on?
Well, I mean, certainly it lives up to the hype, and that it's caused hundreds of thousands of deaths in the world, and caused in our country upwards of 18,000 deaths already. So sure, and yes, but again, to put it in some perspective, we do have as many as 700,000 hospitalizations this year from influenza, and as many as 65,000 deaths from influenza. I mean, we have 65,000 deaths from this virus in this country this year? We'll see, maybe not. But people take flu for granted. I guess it's okay to die from influenza because people think, yeah, it's just influenza. I mean, I've been asked questions in the media. They'll say, well, how about like just the common influenza? I mean, influenza virus can kill you. And there's a vaccine. Now, the vaccine is imperfect. I mean, it offers about 50 to 60% protection against moderate to severe disease, which is, does not make it one of the great vaccines. But that's better than the efficacy when you don't get it, which is 0%. So it's certainly worth getting. Yet, a lot of people in this country don't get a flu vaccine. They take it for granted.
What have we learned about this virus recently? And what do we know about the long-term effects on the lungs and the heart, if any?
And so there is a question about whether or not this virus, COVID-19, causes permanent scarring, and therefore a question of whether there's permanent lung damage. I think it's a little too early to tell that. If you're infected, for example, with a bacteria like Staph, so-called Staph aureus, even MRSA, which is sort of a more resistant strain of Staph aureus, your lungs look pretty bad. I mean, you'll have a collection of pus between your lung and chest wall. Your lungs will be whited out, which is to say there's just intense inflammation, and there can be something called pneumatoceles, which is to say holes in your lung. I mean, holes. The complete destruction of the lung tissue so that there's a hole in your lung. That's called a pneumatocele, and that's common with Staph aureus pneumonia. If you look at those x-rays, you would be surprised to hear that 1 year later, those x-rays are normal. So the lung can heal. We'll see, I think, a year or two from now whether it really did cause permanent lung damage.
A certain orange politician with stakes in a drug company is touting hydroxychloroquine as the miracle drug. Is there any tonic in this snake oil for the masses?
I think what he said was that it will be one of the greatest single advance in the history of medicine. Not a man given to understatement. So what do I think? I think that I'm going to predict that hydroxychloroquine, which is a Sanofi product, will actually not be shown to be effective, but we'll see. I mean, there's other, it might. I mean, certainly in vitro, it seems to be effective, meaning in the laboratory, it seems to be effective. If you take cells in a laboratory and infect them with this COVID-19 and then add this drug to it, it seems to inhibit the capacity of that drug to reproduce itself, that virus to reproduce itself. Will that be true in people? We'll see. There are other drugs like that make more sense to me, which are so-called protease inhibitors. Human immunodeficiency virus, the virus that causes AIDS, has a protease. So these are AIDS drugs. But this virus also has a protease, which just means an enzyme that breaks down protein, that it's part of its strategy for replicating. So will these protease inhibitors work? They make biological sense. We'll see. There was just a paper that was published in the New England Journal of Medicine of about 60 patients or so that were treated with remdesivir, which is one of these protease inhibitors, but they didn't have a control group. So you can't learn anything from a study like that. That's not a study. That's just a compassionate use protocol.
And we also know there's been some controversy around the use of ibuprofen, as it may or may not complicate the virus. What do we know about using ibuprofen?
Yeah, that was like one of those whispering down the line things. I mean, it was there was a group in Vienna, Austria, that posed the notion, the hypothesis that because this virus binds to a part of a protein in the cell called angiotensin converting enzyme, so-called ACE, that maybe ibuprofen would affect ACE, and it's increase the expression of ACE on the surface, and that therefore drugs like ibuprofen, non-steroidal anti-inflammatory drugs, could then make you worse. It was just a hypothesis for which they had no data. Then the Minister of Health in France stepped up and said, don't use NSAIDs, don't use non-steroidal anti-inflammatories like ibuprofen. You can use acetaminophen, i.e. Tylenol. So he basically took a hypothesis and made it a formal recommendation, which then took off across the world, and people thought, okay, I'm not going to use ibuprofen. I mean, my basic feeling about this is, let yourself have fever. Fever is part of your immune response. It's adaptive. We all make fever for a reason. The reason is our immune response works better at a higher temperature, as has been shown over and over again that people that treat fevers tend to have prolonged and worsened symptoms. I actually have a book coming out next Tuesday with HarperCollins called Overkill, When Modern Medicine Goes Too Far. Good time to launch a book, don't you think? Yeah, and the first chapter is treating fever can prolong and worsen illness. So I would say don't use either of those antipyretics, anti-fever medicines to treat fever.
Right. I suppose it was the kids who used to go outside and put mud cakes in their mouth and other stuff in their face, as opposed to the kids who are locking themselves up in their house for many, many years.
No, there's always the notion that you, as a young child, the degree to which you're challenged with a variety of pathogens, makes you less likely to have allergies later in life. There was actually a New England Journal of Medicine editorial once that was titled "Eat Dirt, Please."
I can think of a few things I'd rather eat first. Well, now, the whole point of all this was to flatten the curve. But there's also the concept of getting a spike out of the way early and getting on with life sooner than later. What is your take on that?
Well, so the hope would be that you could develop enough population immunity by natural infection that would stop the spread of the virus. That generally is not the best way to do it. I mean, the only real way, and Bill Gates said this, and I think he's right, the only real way to get population immunity is with a vaccine. So I'll give you an example. I'm a child of the 50s, and so I had measles as a boy. That meant I was protected against measles for the rest of my life, as were all of us. So adults in the 1950s, all for the most part had measles, and all were protected for the rest of their life. Yet every year, 2 to 3 million people in a population of probably 150 million would get measles, and 48,000 would be hospitalized, and 500 would die, because there was still enough of susceptible group in the population to allow for that virus to happen. Now, measles is far more contagious than this virus, but still, I can't imagine we could get to number one. Also, this virus I can imagine would not cause you to be protected for the rest of your life. I mean, with human coronaviruses, which we've identified since the 60s, if you're infected with one particular type of human coronavirus, there's 4 different types. If you're infected with one type, you're probably protected for years, but not decades with that.
Now, is this something for younger folks that they should be worried about? Or do you stand by the notion that allowing the healthy majority of the population, those younger adults without pre-existing conditions, to develop natural herd immunity to serve as a natural vaccination process? Or is that wishful thinking by people like me who aren't experts in virology?
As I said before, I think that immunity would not be really effectively induced by natural infection, only by vaccination. So no, it's never fun to be sick, I think. And even if you're less than 45 and healthy, which is probably the group that's least likely to die from this virus, you still can die from the virus. So, I mean, there still are a handful of children who've died of this virus in this.
The notion to flatten the curve is one thing, but it seems to be getting confused with stopping the curve, and there's no acceptable loss for humanity. At what point are we going to get back to accepting loss, and what would that number be of acceptable deaths? We talked about the seasonal flu. Kills anywhere between 400,000 or so people a year in a flu season, globally. What will be the signal to politicians that are making these reactions that we can resume life with an understanding that people are going to die from a virus, particularly a novel virus?
And once we stop sheltering in place and locking down, more people are going to die from gun violence, more people are going to die from car accidents. That's true too. I mean, life has a certain amount of risk, and COVID is also part of that risk. It's one of many respiratory viruses now that will that has now that we know infects people during the winter, including influenza and respiratory syncytial virus and parainfluenza virus and adenovirus and a variety of viruses. So this one just happened to it's new. It came from China, and no one has ever seen it before, so it has truly caused a worldwide pandemic. But put this in perspective. In 2009, 2010, there was a mild flu pandemic. I mean, what in the scheme of things, there's a flu pandemic pretty much 3 times a century. This was a mild pandemic for which we had a vaccine in advance, and it killed over 200,000 people in the world. And that was a mild pandemic. And it's bad to die, whatever you die from, COVID-19, flu, car accidents, it's all bad. You do the best to try and lessen it, remembering that you don't want to do something like we're doing now that's going to cause a massive second wave of problems. So let's just come up with rules. I mean, at least Angela Merkel, has a rule. Get to 10-day doubling and we can go back to work. I mean, here what we do is we just declare days. I mean, first it was April 12th. We're all going to be celebrating Christmas in church during Easter. And then it's April 30th. And then you have like a governor in Virginia saying, no, it's June 12th or June 10th. And it would be nice to have a federal policy for what is clearly a national problem. I mean, to just turn this over to the states and say good luck is not fair.
If you were able to affect policy on a national level, what would you recommend happen next?
What I would do is I would charge all these different regions and districts and states with providing numbers for where they are. First of all, number one, here's what I would have done. I would have prohibited entry of travelers from China the minute I knew this virus was traveling. I mean, China was not a great actor here. I mean, it shouldn't have required a whistleblower in Wuhan to tell us that this was going on. They should have been a better neighbor, actually. I mean, when you have a novel virus that's killing your citizens, you should let people know about it. And we knew about it. I mean, I think, certainly the intelligence community knew of this as a possible problem in December, and then definitely told us that by mid-January, this was going to be a major problem. And we largely ignored it. And we were very slow to ban travel in from China. We were especially slow also to ban travel in from Europe when France and Italy and Spain were having problems. So we let a large burden come into this country. New York probably being the best example of that. I think a lot of people came into LaGuardia and JFK that had this virus from European countries, and that's why they had the massive explosion they've had. They've had more deaths than in that state than most countries have had. Number one. Number two is I would have really had a large number of people doing the testing. I mean, wouldn't have just sort of confined it to the CDC. I would have also allowed many it's like a growling sound. I don't know.
Oh, that was just my stomach. I ate a baby earlier.
Growling near you. But in any case, and so that you have massive testing like South Korea. I mean, South Korea had tested 150,000 people before we tested 500. So they knew where the problem was, which was really helpful. And so with that, knowing then where it is, then sort of where to kind of and how to lock down. I also would have actually never closed schools. I mean, CDC had never recommended that. They didn't think that would have affected the epidemiology, and I think it wouldn't have. And in fact, there's always these secondary things, right? You send college students home, and now they're all crowding in airports. You send kids home, so now their parents, can't, or now they're spending more time with their grandparents. I mean, is this really what you want? So I just think that I would have always been gathering data to look at when are we starting to lengthen the doubling period. But the only way to know that is with testing. And we never really got the testing out there. We're very slow to get testing out there.
Yeah, so where are we with testing now? There's shorter term tests that are available pretty quickly. There's serum testing that needs to be sent to a lab and takes longer. What are our current capabilities with testing as it stands now?
So there is a rapid PCR test that's been available that can detect virus gene in your nose, which doesn't necessarily, people don't realize this. When people assume that when you're tested positive, that means you're infectious, it doesn't necessarily mean that actually. You're not testing for infectious virus, live virus. You're just testing for virus genes. And they can hang around for a while. I mean, I worked on rotavirus for 25 years. You would shed infectious rotavirus for 6 days. You would be PCR positive for 6 months. I mean, so that doesn't necessarily tell you exactly what you need to know. But in any case, it does. So I think a rapid PCR now is available. So massive produce it, let the government be a pull mechanism and get that test out there in a massive way so we can know where the tiger is here. And then in terms of serological testing, I mean, what that tells you, and that's a better test because that tells you whether you've been infected or not. And I think if you're serologically positive, and we can make a specific test that's going to test just for COVID-19, it doesn't have any cross-reactivity with the other human coronaviruses that circulate every year in this country. The specific test that tells you you've been infected, I think you can assume you're immune. I think if you've been infected with this virus, I think you can assume you're immune. Great. Now you have an army of people who can go out there and do things like work in the healthcare system and not worry that they're going to be the ones that are going to be hurt, or go to nursing homes and spend some time with people who are now isolated and alone because they're not allowed to eat together anymore or have any visitors. I mean, or shop for people who can't go out and shop for themselves. I mean, who are those people? The thing I worry about a little bit though is I was on Inside Edition yesterday, and they asked me the question, what do I think about these home antibody tests that you can now order from Craigslist from China, which is a question arguably that answers itself, but the answer was I wouldn't trust it. And also the FDA has now allowed these home antibody, I think is going to allow home antibody tests without really holding them to a high standard, which is to say it'll say not FDA approved. I think that's about to happen. I don't like that. I mean, it's the same thing with a trip to the General Nutrition Center. The dietary supplements are not a regulated industry, and they'll often say not regulated by the FDA. That's not a good thing. I think these things should be regulated by the FDA. And I know everybody thinks the FDA is, just as a bureaucratic red tape, but I'm actually on the FDA Vaccine Advisory Committee. And so I'm not speaking for the FDA now. I'm not speaking for the FDA. I'm just speaking for me. But I think that it's a good thing to hold products to a certain standard of safety and efficacy and good manufacturing practices. That's good for you. I mean, as Michael Harris, who's an historian, said, the history of drug regulation is built on tombstones, and that is absolutely true. Every time we pass a federal act that holds these products to a higher standard of safety, it's because something awful happened.
I would have to agree with having high standards in life. Look at me. I clearly have high standards. The history of the chaotic control is built on tombstones as well. Well, that about does it for me. So I want to thank you for gracing us with your expertise and knowledge. Continue to fight the good fight and make common sense and health prevail.
Oh, well, good luck to you. Hopefully we should start a free you campaign, now that you're stuck down there in Mexico. Good luck. Hope you get out.
The troll may just decide to become the ruler of Mexico. Care, Dr. Offit.
Nice to meet you.